I want to talk about an exhausted workforce and what happens when a disaster occurs that overwhelms the health system, when our nursing workforce is overworked and overstretched, more so than normal. Who do we rely on to provide additional clinical support? One option, as we've already discussed above, is to rely on nurses from other states or territories or from other organisations. However, this is somewhat limiting, as most have commitments within their own existing jurisdictions. An alternative, which hasn't currently been explored in the context of disasters, is to use unregulated workers. And in particular, I'm referring to undergraduate healthcare professionals. And more so, I'm referring to undergraduate nursing students who may have undertaken a clinical placement within that clinical institution which is now overwhelmed. However, to make this a possibility, what we would require is an element of disaster awareness embedded in undergraduate nursing curriculum. Currently, I'm not aware if disaster awareness or education or training exists in undergraduate nursing programs. However, I would assume that the answer would be that there is none or very little. And if there is, this would most definitely not be consistent across the nation. So at some level, I think there needs to be a discussion about options for supplementing nurses during disasters. As we know, nurses constitute the largest healthcare workforce. And finally, I want to talk about getting the right nurse to the right disaster at the right time. And our discussion so far has somewhat focused on meeting the challenge of getting the right healthcare professional to the disaster area within an appropriate time frame. However, the questions are, in response